This universal adherence to the rules is particularly vital given the likelihood that Fijians may be uniquely vulnerable to this deadly virus. From everything that the experts and scientists are beginning to discover about this new disease, one reality is becoming very clear, that those with underlying health conditions, particularly diabetes, respiratory diseases, heart conditions, and hypertension, are dying in disproportionate numbers. And one must look at some of the figures coming out of the European countries, such as Italy and Spain, where they may not have as many diabetes as we have, but more respiratory illnesses because of the issues around smoking and such, that this is actually true. Those cases are most likely to require hospitalization, most likely to need a ventilator to be able to breathe, and also most likely to die. You must also remember that they do not need ventilators for 3 days. Some of them up to 21 days on the ventilator. And therefore, during their time on the ventilator, it reaches a stage where somebody else who needs a ventilator may not be able to get it. And if this is indeed the case, it leaves Fiji in a frightening position of vulnerability to experience widespread loss of life if the virus is not contained. We all know that our society has had challenges with communicable diseases and also non-communicable diseases. And if we do see a pattern of severe cases spread amongst those with pre-existing conditions, our healthcare systems will likely be stretched and beyond that capacity. And despite our ongoing acquisition with the appropriation that government has given the Ministry of Health in terms of more hospital beds, ventilators, and other life-saving equipment, in the meantime, I encourage all Fijians to use this opportunity to focus on your health and nutrition. Practice physical distancing. It may not mean much to you, but it can save a life. Don't rely on processed foods and unhealthy snacks. Eat fresh fruits and vegetables. It's never too late to take steps to live a healthier life. But it's not just our underlying health conditions that leave Fiji at risk. The way that we physically live, often in very close proximity with multiple generations under the same roof, makes the spread of the disease within Fijian homes almost inevitable. We've seen this with virtually all of our first cases in Fiji. They have gone on to infect their immediate and extended family members. So whilst in Fiji we have a young population, that doesn't mean we'll be spared the worst of COVID-19. In fact, should the spread get out of control, we very well may see a nightmare scenario unfold with the percentage of severe cases and deaths rivaling or even exceeding that we've seen in Italy and Spain. In that regard, I would like to give an advice today as your Minister for Health. Please make arrangements to protect the elderly in your homes. Please make arrangements to protect the vulnerable in your homes. Those who have underlying conditions, make arrangements now on how to protect them. Those who are elderly, make arrangements on how you can protect them. Also, must remember those who are coming out of their 14 days of isolation or self-quarantine. Please do not leave your home unless a doctor has given a certification of clearance. That means the health team will come and check you at home, take your temperature, look at your symptoms, examine you, and certify you before you leave home. Is there any questions from the media to the Ministry of Health?
Minister, the other people who traveled with patient 9, the 57-year-old that you've confirmed from Mombasa, the other people who traveled with him, I believe there were 4, at least that's what the rumors were. Have you managed to trace them, and what sort of action have you taken in terms of contact tracing around them? And can you tell us what sort of contact tracing is happening around the latest cluster?
Thank you. With that cluster that's based out of the 57-year-old, as you alluded to, we have at the moment probably gone through maybe 80% of all the contacts. As you were aware that he was traveling. On top of that, he had gone in between 2 geographical locations, between Suva and Mombasa. The Honorable Prime Minister has talked about how we've now contained the community that is in. We are hoping that by tonight or tomorrow morning we might have contacted almost all. Remember that it's very vast, the number of contacts that he has. Certainly we are very interested in those who had direct contacts with him, but we also realize that because of his travels, there may be others that he may be a part of and that's all in the antennas of our contact tracing team as they begin to fan out and identify individuals that could have been in close contact with him.
Minister, there's a lot of literature on this, so it's, as I'm sure you can understand, it's fueling a lot of rumors online that patient number 9 came back from an event in New Delhi, India, where other people who have gone to the same event have either died or contracted COVID-19. Have you got a hold of the other 4 people that he traveled with to this event in India?
Yes, we have. As of the other day, we had about 2 or 3. I believe at the moment we sort of know all 4 of them. I know there's another one within the Mandolego area that is asymptomatic and has been on self-quarantine. He's followed the rules till now. And again, it's in the best interest of the nation that we continue to keep track of them. And then if anything does happen, we will certainly make sure that the appropriate testing is done. At the moment, that is still limited to him as a cluster. And his cluster includes the family that is in Suva, that is now in isolation unit in Nabua.
What about his family in Suvavou? Are they in isolation as well? And Minister, just going back to your point earlier that the 4 people that he traveled with to India and came back with are in self-isolation, given that patient number 9 himself did not follow directives for self-isolation and quarantine, which were in place by the time he got back into the country, why have you not taken in these people and put them into your government-funded and government-run quarantine and isolation centers?
Thank you. As you were aware at that time, it was a very dynamic situation. We had given instructions that all those traveling back into the country, irrespective of where you came from, that you had to self-isolate and self-quarantine you. Unfortunately, that wasn't done, and as the Honorable Prime Minister alluded to, that is now the reason why we have that cluster that is now in 2 geographical locations in Nambu and Suva. Certainly, the people that have symptoms and have tested positive are all within the isolation units. So the one in Lambasa, the family in Suva, but also that new case in Notoka has been in self-isolation up until now, and certainly the new case that is in Nandi has been in self-isolation till now. So in terms of assessing the risks, at the moment, the risks may be much more if they were all not in self-isolation. They are now. Unfortunately, we cannot move back in time and say and change things, but we've got to deal with what's there at the moment. And our contact tracing team and also our quarantine enforcement teams, in which we involve the discipline forces, are moving very actively on the ground to make sure that we contain that cluster. That's the most important thing at the moment.
So did he go to Suvavou too?
From what we hear, no, he did not go to Suvavou, and there was no contact between him and his family in Suvavou. And we've been assured that. Certainly, there's an understanding of the family in Suvavou, what the diagnosis is, and also the tests that have come out, and they are in the know.
So, Navi from CFL, just asking the doctor about the 5 cases that were mentioned. There's only 4 cases you guys mentioned and 2 other cases of interest. What's the 5th case that has been confirmed?
So, as you know, with the case from Lambasa, we call it as a person of interest until we have confirmation. Normally, as you know, we also do a second round of confirmatory test. And in this case, we're doing the same. And at the moment, we hope to be able to get confirmation soon. And again, at the moment, it's still a person of interest, but we've included that in our numbers because just like the Lambasa came back as positive.
Moving on to the 2 rugby players. You just quoted out 1. The second one?
So the 2 rugby players that the Honourable Prime Minister has alluded to, they both broke quarantine. The specifics around their breaking quarantine is a bit different from the rugby player that is alluded to and the previous rugby player, but the most important thing is they both broke the self-isolation and self-quarantine measures that are in place. It is also very clear from the discussion today that, as a government and as a Minister for Health, I am disappointed with all those who break self-quarantine. I'm disappointed with those who break self-isolation because they put the nation at risk, but more importantly, they put the Ministry of Health and the frontline workers, including the discipline forces, at risk. So that's my disappointment personally. The other thing that I want to say is that this is the time when we really have to realize that we now got COVID-19 in all our 3 important geographical areas. We got it in the West, we got it in the Central Division, we got it in the Northern Division. God forbid it hits the Eastern. But as the Honorable Prime Minister had said, somebody got on a fiber boat, on a fiberglass boat, and went out of Ifereimi into an island. Please don't do those type of things. Don't do it. It may be fun, it may be a dare, but it's daring people's lives. And we do not take that lightly. This is serious. Thank you.